I'm Dr. Ken Landau. Thanks for watching. Let's talk about treatment of depression with Wellbutrin, that's the trade name, the brand name, or Bupropion, that's the generic name. Depression affects about 14 million people in the United States, and we don't know what causes depression. Is it an environmental condition, a developmental condition? Is it a genetic condition? Or is it, as things are getting popularized, an epigenetic condition? And what chemicals are involved in depression? Is it the serotonin, or is it the noradrenaline, or is it dopamine? Or what other kind of monoamine is involved in this condition? Not exactly sure. Popularly, people talk about how they're depressed. But in medicine, you have to have symptoms basically every day for most of the day, and you have to have at least 5 of 9 symptoms. And those symptoms include feeling depressed, having a low mood, feeling tearful, maybe having a decreased interest or pleasure in most activities. Sometimes there's significant weight change, go up or down, change in your sleep pattern, change in your level of activity. Maybe you have fatigue or loss of energy, feelings of guilt or worthlessness, a decreased ability to concentrate, or the feeling you want to commit suicide. Those symptoms, you have to have at least 5 of 9 of those. And one of them has to be either depressed mood or a loss of interest. Now, if you see the family doctor with those kind of symptoms, chances are only 50-50 that you'll have that diagnosis. So the treatment is, among other things, Wellbutrin or Bupropion. Remember, it is not the same thing as buprenorphine. That's to help get you off of the opioids. But when we're talking about the antidepressant, the Wellbutrin or the Bupropion, it's one of the most frequently used antidepressants in the United States and in Canada. It's used by itself or as an add-on medicine to one of the SSRIs, selective serotonin reuptake inhibitors, drugs like Lexapro or Prozac, Zoloft. It's actually not sanctioned for that, but frequently used. It's sold as Wellbutrin to treat depression, but the exact same thing is sold as Zyban to help get you off cigarettes. Doesn't seem to work very well for that, by the way. The drug was initially discovered in 1969, synthesized in 1969 by a chemist at Burroughs Wellcome, and then it went through a series of different owners. Now it happens to be owned by Valiant Pharmaceuticals. The Food and Drug Administration approved it as an antidepressant in 1989. In 2003, it came out as the extended release form. In 2006, it was approved for treatment of the seasonal affective disorder syndrome, now the wintertime depression. It became very popular because it was thought that compared to the other antidepressants, there was less weight gain taking this pill, taking the Wellbutrin or the Bupropion. That's probably not actually true. Over the course of a year, you lose about 5 pounds more than you lose with a placebo. It was thought to make you less sleepy. It was thought to cause less sexual dysfunction than the SSRIs. Actually, that got him into a lot of trouble. It was being promoted off-label and actually ended up with the owners of the drug at the time, GlaxoSmithKline, GSK, ended up paying a $3 billion fine because they were paying doctors, including Dr. Drew Pinsky was involved in all of that. There was some problem that they ended up getting their hands slapped. Well, which of the antidepressants is best? Is it better if you take Effexor or Zoloft or Lexapro or Remeron or Paxil, Prozac, Wellbutrin? Actually, overall, there seems to be relatively little difference. It's a trial and error approach. It's an equal opportunity disease. It affects people less than age 20 and more than age 60. It affects women about 3 times more often than men. And 10% of the people who take the drug, take the Wellbutrin or the Bupropion, are going to end up stopping it because of side effects, adverse reactions to the drug. Seems to help with different aspects of cognition and mood and behavior. So if you happen to have depression and sleepiness and fatigue, maybe you would opt for Bupropion rather than SSRI. But if you have depression with some anxiety, maybe the SSRI, drug like Lexapro, would be a better choice. Well, we talk about response. So if you happen to have pneumonia and you take penicillin, you get better. Well, if you happen to have depression and you take an antidepressant, whether it's Wellbutrin, bupropion or one of the other drugs, chances are you'll have about 50% symptom reduction in about half of the people to maybe 3/4 of the people. You'll have remission in only about 1/3 of the people. Now compare that to placebo, where you have significant symptom reduction in somewhere between 1/4 and 1/2 of the people, and remission in somewhere between 1 in 3 and 1 in 6. Now, oftentimes people don't get better with the first antidepressant they take or the second antidepressant that they take. Question is, do you add on or do you substitute for? There's no good data even today about this. We rate depression on the Hamilton Depression Score. That's a test that you can take, a test that has 21 items, 17 of them are graded, and you get a different kind of a score. The score goes from very severe depression to severe depression, moderate depression, mild depression, or normal. It's rated on depression of your symptoms, the type of symptoms you have. So the same sort of symptoms that I spoke about a moment ago, well, that tells us how bad your depression is. If you take Wellbutrin and you have very severe depression, statistically you're going to end up with moderate depression. If you take a placebo, you'll still have severe depression. Not very severe depression, but severe depression. That was done in several tests, and we've come up with the same answer all the time. Symptoms do not go away. They just seem to get better. Now, if you happen to have SADS, seasonal affective disorder syndrome, and you know it's going to come because it's going to get to be winter time, you take the pills in advance. You take them in the morning, take it for several months, and you take it throughout the winter time. Some people even take it forever. Now, the mechanism of action, we don't know. It prevents the reuptake of norepinephrine and dopamine, so there's more of it floating around the cells. So we call it an atypical antidepressant. Also works on the nicotinic receptor. Doesn't seem to change the serotonin or the histamine or the acetylcholine. Actually, it appears that this drug is altered inside the body to at least 3 metabolites. And the metabolites are actually even more effective than the drug itself. Well, how do you take it? Well, you can take Wellbutrin or the bupropion, the regular immediate release, the SR, and you take 100 milligrams twice a day, then you go up to 100 3 times a day. You can go up to 450 milligrams total. It takes about 4 weeks for the full antidepressant activity. Or if you're taking the extended release, the XL version, you take 150 milligrams, then after 4 days you can bump it up to 300 milligrams, maximum dose again 450 milligrams. Caution, if you have liver or kidney abnormalities, should take it only if it's absolutely necessary, if you're pregnant or breastfeeding. If you're taking the drug, you better not suddenly discontinue taking alcohol or a seizure medicine or a sedative, because if you do, then you might have a seizure. The drug is the same thing as Zyban, so you shouldn't combine the two. And if you happen to take an MAO inhibitor, a drug like Nardil or Parnate, selegiline even, then you shouldn't take Wellbutrin for at least 2 weeks on either side of it. What are some of the side effects? Well, more than 1 in 10 people who take the drug are going to suffer from dry mouth or nausea, insomnia, dizziness, weight loss, or some constipation. Other side effects include agitation or rash, ringing in the ears, blurred vision, feeling tired, change in your taste, more urination than normal, you don't feel well, you get restless, or you have anxiety. It can increase your blood pressure. It can activate the manic phase of bipolar disease. So if you have what we used to call manic depressive disorder, well, if you take the drug, it might increase the manic portion of the disease. I'll tell you about that in a moment. Also can cause acute angle closure glaucoma in people who have narrow angles. The likelihood of a serious allergic reaction to the pill is relatively small. But since we know it can cause seizures, you have to be very careful. We know it can cause mania, so if you have racing thoughts or excessive energy, or you're reckless in your behavior, impulsive, you take risks that you didn't take before, that might be a sign that you're developing mania or hypomania. Obviously, go see your doctor right away. If you have any blurred vision, tunnel vision, you see halos around lights, then you might be having that glaucoma part we talked about. And certainly some people who take the drug can develop agitation, or they can develop hostility or paranoia, confusion. Interestingly, the drug can cause a false positive test for methamphetamine. Major problem with the drug is the potential for suicide or suicide thoughts, especially if you're under age 25. When the drug originally came on the market back in the late 1980s, there seemed to be an increased incidence of seizures associated with the drug, but only with the immediate release form and only at a relatively high dose. So it was taken off the market for a short period of time. Now it's back. Obviously, there's a problem with the epilepsy. So anything that predisposes to epilepsy should mean that you shouldn't take this pill. So if you have anorexia or bulimia, if you have a brain tumor, if you drink too much alcohol, you abuse benzodiazepines, or if you're withdrawing from alcohol or a benzodiazepine, probably shouldn't be taking these kind of drugs. We know it can lower the threshold seizure, especially if you happen to be taking drugs that you wouldn't even think could be associated with epilepsy. So for instance, Cipro or corticosteroids, or the tricyclic antidepressants, or drugs like theophylline maybe for asthma or alcohol, or again, the abrupt withdrawal from alcohol or the benzodiazepines. Hey, this is not a drug for you to take. So there is a bupropion-induced psychosis. That's where you can develop delusions or hallucinations or paranoia or confusions. Seem to be certain people who are at high risk. So people taking a high dose, people who have bipolar disease, people who are taking lithium, people who are older, people who are abusing substances are at high risk. Now, if you overdose on the medicine, that's a potential major problem, because seizures can develop in a third of the people, hallucinations, loss of consciousness, abnormal heart rate. And then if you're taking other kinds of medicines in addition, you can develop fever, muscle rigidity, extreme fall in your blood pressure, extreme elevation in your blood pressure, stupor and coma and respiratory problems. You can die from this stuff. It's metabolized to a series of other compounds that are actually active in the body and present in higher concentrations than the bupropion. And interestingly, even though we've known about the drug for an awfully long time, just in 2016, we found 3 new metabolites that also are very active in the body. And they're as important as the metabolites we knew about beforehand. And interestingly, the concentration in the body can range about 5-fold different in different people. So there's a question about how the drug works, how much of the drug is going to be in your system, and if you happen to take certain kind of medicines that inhibit an enzyme used to metabolize the drug, then you might end up with more drug in your system than you bargained for. So if you happen to also be taking Paxil or Prozac or Zoloft, or you're taking Valium, or even taking bupropion itself, they all increase the concentration of bupropion in the system. On the other hand, if you're taking alcohol, St. John's wort, if you're taking Dilantin or phenobarbital, or even clotrimazole because you have a yeast infection, that can decrease the amount in the system. Well, generic bupropion, or Wellbutrin, came out in 2006. It was said to be bioequivalent, but they only tested the 150 milligram pill. They didn't test the 300 milligram pill. They just figured that it was going to be the same thing, just twice as much of it. But unfortunately, the delivery system was different. It didn't seem to be as effective. It caused an increased incidence of seizures, and people had headache and gastrointestinal disorders and fatigue and anxiety. This was all reported in about 2007. The FDA said, nah, it's just the natural variation of the disorder. But actually, they asked the drug companies to check to see if there was any problem. Drug companies didn't do it, so the FDA took it upon itself. It did it. And by 2012, it found that, oh my goodness, the 300 milligram pill was not equivalent. The generic wasn't equivalent, and the generic only by actually 2 different manufacturers out of about 10 was not the same. that problem has now been taken care of. Well, some people say it helps for attention deficit disorder, ADHD. Teachers think it works. The parents and the clinicians don't think it works. It's not even a first or a second or a third choice. Some people use it as an add-on treatment with a mood stabilizer in people who have bipolar disorder. Doesn't seem to be any significant harm, maybe benefit, maybe not. Some people tried it for discontinuation of cocaine use, didn't seem to work. There's very weak evidence that it'll help you get off methamphetamine. No evidence that it helps for low back pain. No evidence that it really is good for neuropathies. The cost of the medicine will, however, make you sick. So if you want to take the brand name and you want the Wellbutrin XL, 1 month of therapy at 150 milligrams is going to cost you cash price $1,400. And if you take the 300 milligram pill, it will cost you cash about $2,000. Now, if you want to go get the generic product's going to cost you about, with the coupon, $22 or something like that. So Valiant Pharmaceuticals owns the brand name. They charge almost $50 cash price for that pill. The generic variety costs $1.50. Now, Valiant Pharmaceuticals has had some funny business that's gone on. They had a network of affiliated pharmacies that were using this drug, selling this drug, and there are, quote, unanswered questions related to some of the business practices of Valiant. So the relationship has persisted, even though they got in trouble several years ago because of a special relationship they had with Philidor, which was a specialty pharmacy that was selling some, especially, of their dermatologic products. Now, even though Valiant continues to raise the price of this drug that's been available forever, even though the number of prescriptions has fallen by about 50% over the past 2 years, the revenue has risen by about a third, just simply because they keep jacking up the price. Now, on the other hand, if you want to take Prozac, with the coupon, you get that for between $3 and $5. Zoloft costs you about, with the coupon, $9 or $12. So in summary, it seems that the antidepressants almost are a trial and error type drug. You take one for a month or so if you have depression, you see if it helps. If it doesn't, you can stop it and start another one. There's nowhere near 100% efficacy of any of these drugs. And in fact, if you have a 50% reduction in the symptoms, you can consider yourself lucky. And that only happens in about a half of the people who are taking the drug. And unfortunately, the symptoms are just reduced. And if you stop the drug, the symptoms tend to recur. Now, fortunately, there's a lot of research being done in this area, and hopefully, we're going to have some better therapies in the relatively near future. Thanks for watching. I'm Dr. Ken Landau.